Have you ever gone through a heart trouble? Or anyone close to you have gone through a heart trouble? Anything, a minor or a major heart attack, and following that, an angiography or an angioplasty? If yes, this video is very important for you. I am Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Now, if you have gone through an angiography or angioplasty or a heart trouble, you must be taking a medicine that is called a blood thinner. Now, this medicine doesn't actually make the blood thin, but it makes the blood less vulnerable for clots and blocks. So if you are taking this medicine, watch the video till the very end. And the name of this medicine is aspirin, more popularly known as Disprin or Ecosprin. And you'll be surprised to know aspirin is the most studied and most researched medicine of all times. First synthesized by Felix Hoffmann in 1897, it was initially made as a painkiller and an antipyretic. Antipyretic means a medication that controls your fever. Later, through research and clinical trials, it was found that, and by the antiplatelet action, I mean it doesn't allow the platelet to clot. And by the antiplatelet action, I mean is it doesn't allow the platelets to bind together. So blood takes some more time than usual to form a clot. Now, the point behind knowing all these things is, why is it important for cardiac patients to take this medicine? Why are cardiac patients advised to consume aspirin for lifetime, and when these patients should stop taking aspirin, and for how much duration should they be stopping aspirin? We'll be checking it all about this in detail in the next few moments. So before going into the detail of knowing aspirin as a wonder drug and why is it important in patients of heart and stroke, it is very important to know why and how does a heart attack occur. Now, you must be knowing our heart is a pumping machine and it works very similar to a water pump. Now, the water pump needs electricity to keep working, but the difference here is our heart needs blood to keep working. Apart from pumping blood to the other organs, the heart itself needs blood as an energy to keep pumping blood to all our body. And this blood that is needed by heart is supplied by three major blood vessels that are known as coronary arteries. Now, if there is a block in any of these blood vessels, the heart will not be able to pump properly. But the thing is, why does the block occurs at the first place? There are a lot of reasons. Diabetes, blood pressure, thyroid, cholesterol, and even lack of exercise, obesity, lifestyle, unhealthy food, a list of problems and a list of diseases that can make the blocks and clots in your coronaries, and that can lead to a heart attack. But वो कहते हैं ना, लाख दुखों की एक दवा. The reasons for heart attack could be any and could be many, but aspirin is the drug that comes to your rescue. It's a time-tested, widely studied and widely researched medicine with enormous amount of clinical data to prove that it prevents cardiovascular complications. But now, the question is how to go for aspirin and how long to take it. The answer is, if you are a heart patient, if you have ever got a minor or a major cardiac event in your life, and if you are not allergic to aspirin, aspirin should be taken for an entire lifetime. Why? The reason being, aspirin has an action that lasts only for about 3 to 5 days. Now, by the end of 5th day, your body will not be having any residual effect of aspirin in your blood. And the same blood that has caused a block or a clot previously would again be reignited if you are not taking aspirin anymore. Because then, with the reason that the first event occurred, the first cardiac event occurred, by the same reason, the second event will be occurring. And aspirin is crucial in that way that it prevents further clots and blocks in your coronaries, and that is a very important step in preventing further cardiac events. So that means if you have stopped taking aspirin, you are as susceptible to a second event as you were previously. So now the next important question is when to stop taking aspirin or why to stop taking aspirin. The only indication for stopping an aspirin dose is if you are allergic to aspirin. That means you develop breathlessness or itching sensation in your body as soon as you consume a dose of aspirin. In that condition, you should not be taking aspirin. You should consult your physician as soon as possible. Or the second reason is if you are going to have a surgery done. In that case, a physician will be stopping your antiplatelet, that is aspirin, for a few days before surgery, and they'll be restarting the dose after a few days of surgery, because as we discussed previously, it makes the blood less susceptible to clots and blocks, but with that you could have a higher bleeding tendency, and to avoid higher bleeding chance during surgery, aspirin is stopped temporarily. But again, mind my words, it is stopped temporarily and not forever. Forever is the word for aspirin. If you are taking it for a long time, you'll be getting the fruits of your efforts. So I hope all your doubts and questions about aspirin, the wonder drug, are now clear. I am Dr. Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.